Should we start recording when we start the actual program? Otherwise, just 15 minutes will be recording up and no use.
Yes, I'll just inform them.
Hi, am I audible?
Yes, sir.
Hi.
Yeah, Harsh.
Just one thing, on the T1D Foundation, we have Harsh's picture, and on Harsh's
Yes.
ID, we have the ideal picture. So
Yes.
we disable that.
Can't be done now. I'll have to switch on the video once again.
Hi, good evening.
Good evening, sir.
Ash,
Yes, yes, sir.
one is live, one is
Sir?
UFO. Team,
I know, sir. I know, but I had no other option because I am actually in a hospital setting right now and connected with you guys.
sorry, I missed it. What did you say?
I'm in hospital with my uncle right now.
Oh,
He's
yeah.
been
Oh,
unwell
yeah.
since a couple of days, so I'm there with him. So yeah. So I'm doing the webinar from there.
Is he okay now?
He's fine now. He's fine.
Okay. So those who have joined till now, they're all members of the T1D Foundation or
No, just regular participants.
regular participants?
From these various support groups now, you can see people.
Ah,
Good evening, Dr. Kannan.
sorry, could not recognize many here.
Good evening, Harsh. Good evening, Santosh.
Good evening, Dr. Kannan.
I can't see you. Oh, you switched off your video.
जाओ यहाँ से
Ah,
क्या बात होती है पर मम्मी
right.
बोला
ഇതൊരു ഗ്രൂപ്പിൽ വരുന്നത് ഇതിലൊരു സപ്പോർട്ട് ഗ്രൂപ്പ് ഉണ്ട് നമ്മൾ അതിലൊക്കെ രജിസ്റ്റർ ചെയ്തിട്ടുണ്ടെന്ന് കണ്ടോ ഇൻഷുറൻസ് ഉണ്ടാവും മെഡിക്കൽ ഇൻഷുറൻസ് ഒക്കെ ഉണ്ട്
Can we admin mute that?
Yeah, you just send the message.
शापट्टी में अटक कर मेरा साइड
I have muted all. Like whoever
Yeah.
wants to speak, please.
Yeah, thank you, thank you, thank you.
And we have sent reminder today as well, right? For the
Yes.
groups.
Yeah, as per the registrations, we have close to 390 people registered.
Now, sometimes, with the busy evening, they tend to forget, get late.
We just
Yes.
sent a reminder on the support groups as well as on social media.
Mm. Mm. Kannan has messaged that he's logged out and asking somebody to let him in again.
Yeah, yes, sir. I'm asking Karthik.
Shall we give 5 more minutes and then see how?
Yes, sir. Another couple of minutes.
Good evening, Dr. Veeramani, Dr. Anju.
Good evening, Dr. Anju.
I was wondering why I couldn't hear you. Now I can.
Nice to see you.
Yes, good to see this series starting.
Mhm.
So you're all set?
Good evening.
I think so. The team is ready.
Ji.
They've done a lot of work on the back end. So hopefully it should be a useful meeting for all of us.
So shall we start now?
Hello. Sir, it's not audible.
Doctor,
Can you hear us now?
I am.
No, sir.
There's some issue with
We are
the
able
at
to,
your end.
we are able to hear all of you.
So let's. I think Divya, let's start now. It's already.
Yes, sure, Harsh. Riddhi,
You can share the PPT and I'll just start with the session.
Riddhi, please go ahead.
I just shared the
Karthik is not visible. Yeah.
Thank you. Good evening to everyone. A very warm welcome to all the panelists, speakers, as well as the participants who have joined us today. As we all know, this is one of the most important yet least discussed topics, type 1 diabetes and medical insurance related to type 1 diabetes. Thank you so much, speakers, panelists, for being with us here today and sparing your valuable time. Without taking much time further, I'd like to introduce our panelists and speakers. Let me begin with Harsh Kohli. He is a patient advocate from Delhi, certified diabetes educator, associate member with ISPE, and living with T1D since 31 years. Not only is he himself living with T1, but he's also a parent to a T1 boy. And with that, he brings us all his experience learning about insurance, his insights, as well as he'll enlighten us with the different companies and what are the features of each of the insurance policies. And then going ahead, we have Dr. Subramanian Kannan. He's a consultant with Narayana Hridayalaya Hospitals at Bangalore. Dr. Santosh Oleti Satyanarayana. He's an associate professor and HOD with pediatric as well as adolescent endocrinology at Karnataka Institute of Endocrinology and Research at Bengaluru. With that, we bring a lot of experience, a lot of curiosity, and And I wish you all a very enlightening and educational session. So with that, we hand over to Harsh to begin, because we have been waiting for this session and we are all excited as well as, eager to know. With the burdening cost of type 1 diabetes, insurance is one of the most important things. So let's hear from Harsh. Over to you, Harsh.
A very good evening to each one of you, and thank you so much for joining us on a Wednesday evening. I'd like to say the very onset that the very basic tenet of insurance is insurance acts on only one principle, and that principle is principle of utmost faith. So when we mean utmost faith, if you're telling us something, we do not assume it to be true. We take it to be true. So please remember this. Whenever you're buying any insurance cover, do not hide any of your issues with the insurers. This will lead to a proper and a healthy relationship between you and the insurer. With this, I'd like to pass on the baton to Dr. Santosh and Dr. Kannan. And we'll be able to take the discussion forward and really keep on coming back. Thank you.
Hi, good evening. And thanks to Type 1 Diabetes Foundation, for bringing such an important topic for on this platform to learn and share with others as well. We'll be just looking at why insurance is required for children with diabetes. How is it different from other children who doesn't have diabetes, and also how the what steps been taken so far in India, trying to sort out the challenges and issues of getting insurance for families with children with diabetes, and also slightly sneak through how the health system elsewhere outside India deal with these issues. So we'll discuss this more, and I'll hand over to Dr. Subramanian. And after that, I think we have a PowerPoint presentation by one of our panel members. Yeah. Dr. Kannan.
Yeah, sorry, some internet instability at my side. I'm not sure why. I think as we go towards healthcare, which is becoming increasingly expensive every day, a lot of hospitalizations, elective surgeries, emergency room visits, become quite expensive. And I think it's imperative for all of us, all to be in this spectrum where you get good quality healthcare in certain areas, and they are expensive. So I think it's important that this awareness about getting a health insurance is fundamental, and I think one should always look at or look at the people who are able to support the health insurance companies that are able to support us in this process. Harsh made an important point about trust. The other important point about the insurance is about the odds. What are the odds of you having a problem? That's how the insurance companies work. If somebody is having a higher odds of or a higher risk of having a particular problem, they probably would desist or not try to involve that particular proposal. So let us be honest that there are certain illnesses which we will need some kind of coverage at some point now. If you take from an adult point of view, people with diabetes are at a higher risk of developing cataracts, are at a higher risk of developing gallstones. They may have problems with pointer or ligament. And all these things will require some kind of an operative or some kind of an interventional procedure. And these things, it's a good idea to study and apply under a suitable insurance plan and get oneself insured. So I think it's extremely important, and this idea of getting insured itself is an important step in the right direction.
Can you please move on to the next the slide?
So just before we begin, we'd just like to say we had floated a Google form and we have received an overwhelming response from almost 384 people. And we'll go over this to just share some insights, like, basically, how did we do state-wise, how many responses we have received. And we also try to find out whether people are part of a support group or they have found out about this independently, and how did they hear about the webinar. But more importantly, we want this to be a very large outreach, particularly to people who really don't have much access to support groups. So towards the end of the session, we'll be sharing a link for our T1D Foundation website so that everyone can get onto the website, find out about the support groups which are working towards this cause in different states. And over to you, Harsh.
Yeah, can we move on to the next slide, please? So yeah, so out of the respondents, 27% have said that they are insured, and 73%, that's an overwhelming number, that they don't have any insurance cover. Some of them have insurance cover from private insurance companies. Some of them have their employee insurance. So some of them have the nationalized insurance companies, but still the majority of them are uninsured. So this brings us to a very important point. Why are these people uninsured? Is it because of the lack of knowledge that they are unable to buy a suitable insurance plan, or they don't they cannot afford that? So let's delve deeper over to Dr. Santosh and Dr. Kannan for further discussion. Sir.
Yeah. So, can you want to take over? Then I'll.
Yeah. I think the fundamental issue is lack of awareness, and I think that I think is probably the main reason why people are not looking into this aspect of their healthcare. I mean, again, insurance is part of their healthcare, like how we have a medical provider, how we have a provider should also become part of your healthcare team. And I think that lack of awareness is probably the reason why I would assume, again, this is just an assumption at this point, that probably that is the reason why it is. And I'm reasonably, there must be some issues with cost, but I think that probably is only secondary. I think the primary driving problem here, which is showing up on the pie chart, is probably related to awareness about taking up insurance, and why is it important at this point of time.
So I feel same, but see, when we compare not only families with type 1 diabetes, you compare with the families who don't have diabetes. I think the insurance coverage will be poor for them as well. One is it's common problem both with or without diabetes. The percentage of insurance cover is quite low. I think maybe it's gradually getting better and better. Second is maybe if you take few years back, more than 5 years back, the number of companies who were providing insurance to cover diabetes as a product, there were only few options. I think with that, people assume that insurance companies doesn't cover, or maybe they had a very bad experience that they were outrightly refused for insurance because of the diabetes as the underlying condition. So that could also contribute. And the kind of patients I come across is a lot of them from low socioeconomic strata. I think for them, spending premium for insurance might be a little tight with their budget. because most of them access to government hospitals for any problems or complications where it is free. But maybe that's might be one of the reasons why they don't look for insurance, because they feel government hospitals are there if anything happens to get admitted. So that's few points from my side about this.
The other aspect to this is also about employees cover. I mean, a lot of the companies which where the head of the family is employed either gets an ESI coverage or a CGHS coverage, or for that matter, it's a private company. They have a health insurance cover, and that is now becoming an important aspect in terms of the family cover. So once the main person is covered, then the family also starts getting coverage. So I think, uh, uh, barring very small jobs in very small sectors, most of the medium sector and the large sector industries and companies are now fairly being covered with health insurances. So I think, uh, if so, I think this is an area where I think it will become more and more available at a fairly reasonable cost for the patients as well as the families.
I think another important aspect from the person living with diabetes that I think I can think of from an advocacy point of view is that many times there is a lot of resistance in disclosing the medical condition. So we are still unfortunately living with a lot of stigma and discrimination, with this condition. So this would be like an earnest request to all the participants who are here, that not to hide about their medical condition, as Harsh also rightly pointed out.
And I can also assume one of the other reasons where families might be reluctant is because they expect with insurance to have all their medications, insulin, consumables to be reimbursed. So maybe I don't know if that puts off them when the company says the insurance only for acute crisis, not for your regular consumables. I mean,
So,
somebody can share that from the.
so let me come in over here and answer that why this can be detrimental. Very how our insurance works. Like the money is all the money is put inside a pool. It's called a cess pool. Whatever premiums are collected, they're all there in that pool. So whenever a claim arises, the money is parked in some funds wherein the interest is accrued. From the interest accrued, the insurer they make money, as in they're able to make their employee expenses, managerial expenses, and all those expenses. So whenever a claim arises, our claims are paid out of that amount. Now imagine if we ask the insurers to reimburse us for the cost of insulins, our sensors. So that's going to shoot up the claims exponentially. And next year, what's going to happen? Our premium will rise. So the best option in a country like India is to take insurance, as you said, only for hospitalization situations, and which we know that as someone who's been living with type 1 diabetes for past 31 years, I don't think I've been hospitalized more than twice or thrice. That was
No, right.
way back in 20. Yes.
No, you're right, Ash. I mean, that's what I mean. The expectation from the family might be different from what is being offered. And as you said, it's not a sustainable product to reimburse all the consumables. Otherwise, the insurance company is going to debt, and as you said, the premium will be again comes over for the people who buy the insurance. It's not only for diabetes. I think any health conditions. I think the project and a product is same. It's only for acute problems or complications, or some selected, elective surgeries also being covered.
We've all practically seen health insurance premiums. They've already shot up post COVID. That's because of the irreversible claim ratios. So maybe we can move on to the next slide and get on to the questions which have been put forward ahead to us. So again, Riddhi, would you like to chip in and
Yeah, sure.
take this slide?
So here we've tried to, get some information from our participants, whether, they have taken any insurance prior to getting diagnosed with type 1 diabetes, or whether it was after finding out about the condition. And how do they feel? Are they satisfied, not satisfied? Have they mentioned? Are they unsure? So these are a lot of different responses we have received. At this point, we won't discuss much about this, but all we want to bring to light is that there is still a lot of awareness. A lot more information needs to go out there to people to say what is the right way to go about this, what are the policies available. So I think it might help if Harsh can just, share with us, what are the companies who are providing cover, what kind of insurance is good for kids and adults living with type 1, which company can cover what kind of expenses. Do we have insurance which is covering pumps, CGMS, consumables? So there are a lot of questions which have come in. So I think let's get on to the next slide and then answer the questions one by one. We would request all the participants to keep their audio on mute so that we can make the most of this time.
ഈ മീറ്റിംഗ് മലയാളത്തിലുണ്ടോ ഇംഗ്ലീഷിൽ മാത്രമേ ഉള്ളോ? ഐ ആം എ മലയാളി. only English. മലയാളം ഉണ്ടോ ക്ലാസ്?
We will take care that we communicate in English. Thank you.
അതെ, ഞങ്ങൾക്കെല്ലാം മലയാളമാണ് കുറച്ചുകൂടി നല്ലത്. മലയാളത്തിലായാൽ കുറച്ചുകൂടി എല്ലാവർക്കും സൗകര്യപ്രദമായ രീതിയിൽ മനസ്സിലാവുമായിരുന്നു. ഇത് ഇംഗ്ലീഷിൽ തന്നെ
Can I request Mr. Santosh and Aviram to mute, because you can put your questions in the chat box. Let's continue with our discussion.
Another thing we can help with this, after today's session is over, we'll try to reach out to the support groups as well as specific regional language queries which are there. You can email us on the foundation email ID and we'll make sure the information gets across to you in your requested language. So thank you for cooperating. Let's move on. The first question we'd like Harsh to address is that normally does this insurance cover regular tests like HbA1c, and what is it that you can throw light on for diagnostics related insurance cover?
Riddhi, before we go on, can I just
yes, please.
Then they can always get it translated later. We can send them the recording and they can get it translated.
Sure, definitely.
Yeah, so Riddhi, not all insurers, they offer us so like few companies in SDFC Airport, they'll ask us to undergo annual test. Aditya Birla Health Insurance, if you opt in for their card, they'll ask. So, and this is the only company which asks to regularly undergo HbA1c test, and annually they pay once a year for these tests, so we can go to their facilities and get these tests done. But rest of the tests we have to get it done on our own. And can you move on to the next question?
Yeah, is there any insurance that currently covers insulin, glucometer strips, sensors, etc.? All these consumables, are they under some insurance cover?
I answered that question just a few minutes back. Now, none of the companies in India is offering the reimbursement for the consumables, and that should not be encouraged as well. I listed out the reason as well.
Okay, is there any particular insurance that you would like to recommend for children living with type 1 diabetes? Is there like a roadmap that you can help all our participants with? Like, how do they go about it?
And I'd like to add a disclaimer first. We are in no way our intention is not in any way to earn money out of this. We don't have any sort of commercial interest with this. So there are various insurance companies. Personally, I would prefer going to a nationalized insurance company, because once we technically call it underwriting a policy. They underwrite your policy. There are very less chances of a claim being denied. When I say less chances of a claim being denied, it again depends on us. The disclosure has to be full. The disclosure has to be absolutely. Don't hide it. There is an option in our proposal form where it clearly asks for any pre-existing diseases. Please do mention that type 1 diabetes, and in bracket, because for the insurers you need to make them understand that it's insulin dependent diabetes. In India, we are struggling to differentiate between type 1 and type 2 diabetes in our healthcare scenario. So please do mention that yes, we do take insulin. So for children, you can undergo national insurance companies is called the Parivar Mediclaim policy. You can go in for the New India Assurance companies, their family floater plan. Then for private insurers, Care Health is they offer policies. Aditya Birla is another option, but yes, Aditya Birla is expensive. It does offer one-time reimbursement annually for I think 15,000 rupees, but the premiums are expensive. For those above 18, the plan which I have found out to be good so far, that's HDFC Energy plan, because they make you undergo a lot of tests before they go ahead and give you the policy, and they will take an additional premium of 20% on the base premium. That's called loading. They load an extra 20% on account of the fact that we take insulin.
Yeah, that definitely adds a lot more to the already existing base. We have a question where one of our participants wants to know, I took health insurance through Policy Bazaar. Does taking policy through Policy Bazaar lead to some problems? Because, later on, the branch manager suggested them to cancel the policy and take it directly from the company. So do you have any experience or recommendation in such kind of scenarios?
See, again, I'd always recommend whenever purchasing a policy for yourself, please do try and walk to your nearest insurer office. Have a one-on-one conversation with any of the senior there, so that you very well are able to know that from day one that this is covered and this is not covered. Like if you go in for the New India Assurance policy, they'll put in a 3-year. After those 3 years, you stand covered. For another nationalized insurers, that the national insurance, the plan which they offer is they'll charge an extra premium only on the person who has type 1 diabetes and give you cover from day one. And these things you'll only be able to understand once you pull out the prospectus, read out the prospectus to the people sitting over there. And I'll reiterating one important thing over here. If they try to deny you insurance, just ask them to give you writing. That's it. In all probability, they won't do that. Well, they will have to give you the insurance cover.
Another question we have here is, what would be the waiting period for any illness or condition which is triggered by type 1 diabetes? So is there anything you'd like to share with the audience on that, Harsh?
I take it as an example. I mean, say like I have NPDR. It after 31 years. So as of now, and government IADI regulations policy, if it's running in continuation for more than 4 years, you cannot deny any claim for that. Whatever premiums arising, it cannot be denied because you have paid 4 successful premiums.
Anything the doctors would like to add to this? Feel free to just add to your comments.
I think in our discussion, we were saying there are certain policies where you can there's no waiting period, but your premium will be quite high. I think the Star Health has got some options, and Manipal Cigna has also some options. But generally, I think it's around a couple of 2 years or so for waiting. Not for just diabetes. I think in general for any elective surgeries, and they would have listed list of conditions where there is waiting period. Specific to diabetes claims, I can't. I'm not sure about it.
Yeah. Generally about, I mean, the waiting period for some of the insurances that uh, what I have
Dr. Kannan,
seen and
Dr.
what we
Kannan, you
have
can
taken is
switch off
about 2
your
years.
video so that it's breaking a lot. Yeah, now you can.
Yeah, can you hear me now?
Yes.
Yeah, better.
Yeah. The waiting periods generally are about 1 to 2 years for most insurance companies. And that is where I think what Harsh pointed out is so important. Because if you have a claim and you've not disclosed diabetes in your initial uh, proposal, and they find out from the medical records somehow or from the discharge summary that there was diabetes even before you had gotten the insurance, they have the right to deny the claim. So I think this waiting period is extremely important for us to accept, and that's part of how the medical insurance will also want to know and judge you in terms of how you are and how things are progressing in the first couple of years. So I think it's extremely important to be very honest and upfront with all the medical illnesses that you have right when you when you apply for the insurance.
I want to ask Harsh, will this waiting period be applicable both for retail product and for a group, purchase through the corporate or companies when they buy bulk insurances for their employees? Does this waiting period still apply for them as well?
No, sir. Waiting periods are specific only to retail policies. Whenever
Retail
going in
product.
for a corporate insurance companies or an employer-employee cover, or say as an example, tomorrow the Type 1 Diabetes Foundation decides that the foundation wishes to purchase an insurance cover for the members. The pre-existing diseases will be covered from day one. They are covered. No waiting period.
Right.
But then the period, the coverage amount may also be limited. It may not be as high as what you get.
So the maximum covers as of now in a
When you're
corporate
going for
health
a
cover
group
is 10
coverage,
lakh rupees. 10 lakh rupees. Maximum it is 10 lakh rupees as of now.
Okay, we have one more question. Can people living with type 1 diabetes get access to term insurance?
Yes, the answer is yes. How it happens? Any normal person going in for a term insurance plan, they have to undergo medical tests. That's mandatory as per their requirements. So when buying a term insurance plan, please do declare it to the insurer that you have type 1 diabetes. Once you clear the medicals, they might put a loading of up to 20 to 40% on your base premium. And please understand, loading is not one time. The loading is for all your premiums. Getting bound for saying a term insurance plan for 20 years or 25 years, you have to pay the same premium the 25 years along with the loading.
Okay, we have a family here. They have corporate insurance, which is already existing with their employer. And recently they have a young child who has been diagnosed with type 1 diabetes. Harsh, would you advise them to take additional insurance, especially for the child?
I would highly recommend buying a cover for a child, but as we know, in India, the current regulation says that a child cannot buy an insurance plan. So some one of the parents will have to get himself or herself insured along with the child, and they can
Okay.
and they can opt.
In such a case, what happens to a family policy coverage when a child turns 18? How does that transition work?
You already declared that for the child, the policy gets split up, and because you have been paying premium for the child, and since you have been paying premium for the child from the day of the inception of the policy, the child will automatically stand covered.
There's a suggestion if you can switch off your video because I think they might be finding difficult with your audio.
I hope the voice is better now.
Yeah.
Yeah.
Okay.
Harsh, just a point to add on, ask or add. I think it's always good to have, that's what I have been told. I think the coverage by your corporate employee is good, but you never know when your job will terminate and the insurance will end as soon as the contract ends. So, and you don't want to get stuck in a place where you don't have an insurance for a while. So I think it's always sensible to get an add-on insurance along with a corporate insurance.
Yes. Absolutely right, sir.
I think that answers are very, very well, because then we have additional cover and we are not only dependent on that particular employer.
Yeah, hello. I have a couple of questions, if I may. Is that all right? So I recently had a DKA incident, and I luckily had my insurance cover from when I was 5 years old. I was diagnosed with T1D at 10 years old, and it never, they never caught on that, and the claim went through. So what do you think is the ideal procedure? I got it before I was diagnosed. Do you think I should update them and let them know that, okay, I'm type 1 diabetic, and what do you think might be the outcome? Since I got it before, do you think they'll hike up the premiums or something like that? I'm very confused on that.
Santosh sir, can you answer it from a medical point of view? I'll answer from the insurance point of view.
So if I understood, you're saying you have declared that you got type 1 diabetes, and
I have not declared.
You're not declared.
I got it when I was 5. The plan, it was a family plan, and now I was diagnosed when I was 10. So the plan is still active. And they did not check in when, they did not verify when I recently went through a DKA episode.
So they were able to, approve your claim.
Yeah, no questions are there, is approve the claim. So.
Okay, that's lucky, I think, because usually, they're quite, quite critical about this.
Mm-hmm.
So if they would know that you have not declared your underlying condition before, I think they had all rights to disapprove your claim. So as Ash and all of us as right from beginning, we're saying it's always best to put our honest declaration about whatever conditions we have. Otherwise, because recently I had a child. Again, father was saying, even the family, they haven't declared the child's condition when they renewed their family floater, and child went into a DK, and the company refused to approve their claim because they came to know the child was already diagnosed sometime back. So I think in your case, you might be lucky, but generally very high chance that it can be disapproved.
Yeah, got that. So the intention is to actually switch plans and Harsh was saying, I think the idea is to go to an HDFC Ergo energy plan. That's like the most recommended, and it says that's the one without any sort of waiting periods for type 1 diabetics. Of course, yeah, the loads I think the load fee or something that was said, an additional 20% fee might be there for type 1 diabetics, but the plan is to move on to.
Sharon, the best is to get hold of your discharge summary. Then I can guide you in a better way. We can email us on the foundation email ID, and we'll be able to guide you better.
Sounds good.
Get hold of your discharge summary first.
All right. One more question. This will be from a more futuristic point of view.
Maybe you can post it in the chat box now.
Request everyone to post it on the chat box so that we can cover up maximum questions. And if there are any specific queries, you can always write to us at the foundation email ID. Thank you so much. We have one question here where one of the participants wants to know, is insulin pump and CGM being covered by any of the insurance companies specifically?
No, I mean, as of now, none of the companies will cover your consumables, insulin or device, sensors or the pump consumables. So all the insurance which we provide is to cover your acute crisis. It can be diabetes related or it can be non-diabetic related as well. Like, you can have a febrile illness, dengue, typhoid, or a trauma, or some elective surgeries. But I don't think any of the products as of now in India covers reimbursing your consumables.
Another thing we would like to know is that if any of the doctors can throw some light on what is the status of T1D and medical insurance in other leading countries. Like, how is it being managed? Do we have any benchmarking numbers there or any percentage of insurance cover? So if any of you would like to answer that.
Yeah, well, I can share what happens in United Kingdom. Yeah, Kanan, you want to go? Okay.
Let's go on. Yeah.
So, see, in UK, the system is a national health care, NHS, National Health Services. So the healthcare is free for every citizen there. So all they have to do is they pay their taxes genuinely, sincerely, and everybody is covered. All the consumables, everything is given free for children at least. The sensor, the insulin, the needles, and the pump, if they qualify. So everything is provided free under the National Health Scheme. So they don't need to spend any money or paisa for that. Again, they have to, but for adults, I think there's a minimum charges per prescription. They pay around £5 or £7 every prescription, but there's no limit how much you can prescribe in that one prescription. So generally, it is a free health service in UK and more or less quite similar in a lot of West European countries. But in India, I think it's mixed healthcare. We have private, public, but even in government hospitals, only few places are giving free insulin under different support resources. Otherwise, it's all from the personal expenses from the pocket. I think Kanan can share his views.
Yeah. So I don't have numbers to quote, but I'll tell you the broad way the system works in the US. There is obviously the best part of coverage is the private coverage. So if you have a private insurance like Cigna or one of the multinational private insurance companies, they are generally good. They have fairly robust covering systems you have a copay for your outpatient visit. You don't have to pay the full amount for the consultation, but there's a copay for the consultations, and then your periodic tests also you get a coverage, as well as when you are admitted in the hospital for either elective or emergency situations, they are fairly well covered. So there's not much of a complaint from the private insurance company clients. Whereas if it's the government-based, it's usually the Medicare and Medicaid coverage. So children get covered as well as the senior citizens get covered in this scheme. Again, there is limited coverage, and the hospitals that you can access to with these covers are also limited. Supply of insulin, some of the novel or newer anti-diabetic drugs may not be fully covered under some of these schemes. So you are forced to go with certain brands, with certain insulins only when you're in these covers. The other model that I think Narayana is trying to replicate is the Kaiser Permanente model. Kaiser Permanente is where, see, in all this game of things, there is one company which is trying to not give the money, and the other person is the hospital which wants the money. So it's a kind of a tussle between the two. I think the Kaiser Permanente model is where the hospital itself is giving the insurance. So you have a hospital which is actually giving you the insurance, and is the hospital itself is going to take care of you. So that's the Kaiser Permanente model, or managed healthcare model. So I think that's where. But the issue there is the person is then will have to follow up only in that system. So as long as you're in the system, you will get covered. If you're going out of the system, you probably will not get covered. So those are some of the broad insurance practices in the United States. Suffice to say that if you're rich and if you have money, you get fairly good coverage. If you don't have money, the healthcare system is really expensive in the US, and it's very painful to see a lot of patients who cannot afford reasonably good insulins. Also, even analog insulin, sometimes I would find it very hard to give to some of the patients there because their insurance, they would not be able to buy it. And so I think that's where things are in the Western country. A little bit of a skewed distribution of the insurance in that community.
Right.
I would like to say, and it's very difficult to replicate their system into our society. It doesn't work. It doesn't fit into our society. It's the same like UK or US. So we need to look and modify and revise, which will be suitable for our community. So we have to derive our own innovations, trying to improvise the insurance access and the cover and affordability.
Right.
Yeah. Yes.
Also, as a part of this system, as a person who's going to apply for insurance, are there any loopholes in the system that one has to be aware about, or is there like a standardized checklist that we need to be following or be aware about?
Be true to the insurer.
So maybe Harsh, in your experience,
Be true to the insurer. That's it. Do not hide anything. The checklist for us should be, if in case they're denying you the cover, insist for a written denial. Because as of now, insurance on the front, it does not seem like a regulated field, but it's one of the highly regulated fields in the country. So please do ask for a denial letter. And again, do not hide your condition. Be very open that yes, you or the child is on insulin, and at least from if it's a nationalized insurer, they will not deny insurance. A private insurance company, they do have ways they may deny the cover, but a nationalized insurance company, they'll never deny you the cover.
I just want to add one. I think there are certain insurance companies who are very particular with your glycemic control. See if they have a target, like you keep your glycemic HbA1c less than 7.5, something like that. In which case anything happens, they're easy to approve the claims. If your HbA1c is quite high, there are certain companies you are quite critical about that, and it might affect your approval as well as next renewal premium as well.
Yeah, I think from the healthcare point of view, I think very few insurance companies really understand what drives complications in type 1, what are the things they have to monitor, what are the tests that they have to do before approving the proposal. So, and I think there's a lot of lacuna in this area. And I think if hopefully these things will slowly close down, and there is a more and more companies are able to offer with, as Santosh said, they also would want to know that if the particular person who's applied for the insurance is under fairly good control and is keeping up with his appointments, is getting his HbA1c is checked periodically, is annually screened for his retina and as for his kidneys. So I'm sure there will evolve some kind of a system wherein which they will make sure that instead of just an annual HbA1c, they would want more.
Yeah.
They would want more to ensure that you're going in the right way. So I think things are still at a very nascent stage right now. People, I think the patients themselves get it done from their knowledge point of view, but I think from the insurance company point of view, I think these things will slowly start becoming mandatory.
Right. Because I think they also need to make us accountable, right? Because if they are going to provide with that cover, even the person living with the condition should be giving that kind of importance to prioritizing their own health. So it's
Right.
like a two-way thing. But yes, lot more awareness needs to go out, so that it can be taken to the next level.
So with regard to that, because we all agree that there's a lot of lack of understanding between the underwriters of the insurance who create these products and what exactly happens with the families. Because most of the time, because of the poor understanding, the insurance companies they refuse to approve the insurance or refuse to give the enhancement when it comes for renewal. So there are a lot of challenges I think people with diabetes or people having a child with diabetes are facing. So trying to overcome these, one of the initiatives from PPHF, one of the NGOs, they've started this initiative called DISHA, Diabetes Education and Empowerment Strategic Health Alliance. So they have separate special interest groups, and one of the interest groups is the insurance. And we, through that, we are trying to contact the IRDA representatives and try. What we understand is they really don't understand, type 1 diabetes much. So when we educate them, I think some of the challenges can be easily resolved, which are barriers between the, for the approval of the insurance. As Kanan said, as time goes, a lot of things will be teased out and maybe things get better and better as time goes.
Right. There's one more particular question which, the user would like to know. Does insurance cover bone marrow or pancreas transplants or any particular treatment which is related to living with type 1 diabetes?
And even without diabetes, I don't think any of the products cover your bone marrow transplant or any other solid organ transplant.
Not all the plans, but few plans they do.
I think the one was a star one, which they were covering it, but I think it will be. I mean, in that case, the premium will be
generalized. Yes,
Yeah.
it's a generalized plan, and the sum insured are higher, like 20 lakhs and above.
Okay. Besides this, we would like to ask Harsh if there are any other take-home messages that you would like to share with the participants.
Before that, Ash, can we ask Dr. Anju is here? Maybe she can share some of her experience.
Yes, ma'am. Please, Anju, ma'am, if you can please unmute
and
share
Dr.
the practical.
Sirisha also, if Dr. Sirisha and Anju can share something,
Please enlighten us, doctor.
Not really. I think I've learned a lot in the last half an hour. But yes, it's very tricky slope because most people seem to think that insurance companies have some funds of their own. The fact is the money that they're using is our money after they have spent their administrative costs. So when you have very high expectations, it can only be at the cost of very, very high premiums. That's all I would like to add.
And Dr. Sirisha, if you're still here, anything you want to share? Okay, maybe she's not here. Yes, back to you, Ash.
So the key take-home message is that you, in all probability, if you go to a nationalized insurance company, you will not be denied an insurance cover. Insurance is the basic tenet, basic principle is it acts on the principle of utmost faith. Do not hide anything. Take anything in return. If it's a denial, it has to be in return. Please reach out to a senior functionary in any of the government departments. We'll be sharing the list soon. We'll be again circulating the document on our social media platforms and everywhere, wherein we had tried to collate a list of the companies which are currently offering insurance plans to people with type 1 diabetes in India.
Yes, so I think a lot of participants here, we can get in touch with our local support groups or write to us on T1D Foundation of India's email ID, and we'll share all the information that you all are seeking. The suitable plans, as well as any other advice that you would like, particularly for your case from Harsh or any of our doctor panels or on the panel here, we'll reach out to you with that information.
Riddhi, can we also share that PPT, the questionnaire outcomes to the groups as well, so that they can also?
Yes. Definitely.
Thank
Definitely, we'll do that. Okay, I think we have one last question, and then we are ready to wrap up our session. There's somebody who wants to know that they were rejected from United Insurance and SBI and Star Life. So is there any input that we would like to give in case of this particular case?
Again, Nivedita, if you have something in written, please, we request you to share it with us. We'll try and see you.
And it might be better to speak to the senior most,
Yes.
rather than the agent. Try to access to one of the senior most person who might have better understanding about this and might give you some solution. Because as I said, I mean, a lot of them are covering. It should be covered under family floater, but they should specify the reason why they want to refuse it.
Right. I think with this, if any of the doctors have any other take-home messages, we can, wait for that or sign off.
Yeah, I think as we kept saying again and again and again, don't hide any conditions or comorbidities. Be upfront and honest and truthful. And I think seek out and get help and get yourself insured. I think that is very, very important. Whether you are having diabetes or not having diabetes, I think getting insured is important because healthcare costs are high for any kind of emergency or elective hospitalizations. So, best wishes to all of them.
Right.
Yeah. Thank you, for this platform. I mean, we also learned from the experience from the others as well. Thank you, Type 1 Foundation India.
Thank you, respected
Thank you
doctors
so much,
for-
Dr. Santosh, Dr. Subramanian, for being here. We would like Prashant to give us a message if he's available.
Yeah, so good evening, everyone. So I think the key takeaway points, and there are like many policy and specific inputs that people have asked to share in the chat box. I think we will put it in the social media platform in our Insta handle and Twitter handles, and we'll share it in the group so that you can have a specific information on all that. And please post your query there as well. Harsh and others and the doctors will be happy to give you solutions and answers. Thank you.
Thank you all the participants for being here today. Thank you, Harsh, for sharing all your experiences as well as invaluable insights. The summary here is having insurance is very, very important. Type 1 diabetes or any other condition or no condition. Getting an insurance is very important. People with T1D, living with T1D or caregivers, the message that needs to go out is do not hide your condition. If there is a difficulty where teenagers or other children are finding it difficult to cope with how to share this information or how to accept this condition, please reach out to us on our various support groups. We will be more than happy to help you out. What is very important is not to hide it. And more so, we would just like to take a minute to thank everyone here. And also, we'll be sharing our website on the the end of the session, so you can log in and check out for all the support groups which are available in the different states. You can reach out to us through our email ID, and we would just like to take a minute to share that this particular session was organized only for education and awareness purpose, and there is no kind of commercial interest here, nor are we proposing or pushing for any particular policy. But we would request you to approach a healthcare professional or an insurance personnel to find out which is the best policy for you. So with that, thank you very much and have a good evening.
Thank you all. Thank you so much.
Bye.
Bye.
Thank you. Thank you very much.
Will the website be shared?
Yes, I'll be just sharing.
Shall we close the session, Riddhi?
Yes.
Yeah, okay. Bye. Bye.